Hello, everyone. Thank you for coming to Pediatric Grand Rounds. My name is Iris Borowski, and it's my pleasure to introduce our Grand Rounds speaker today, Dr. Cathy Jordan. So Cathy is an associate professor of pediatrics in the Division of General Pediatrics and Adolescent Health. She completed her doctoral training in clinical psychology at Wayne State University, followed by an internship in clinical neuropsychology at Brown University. She came here to the University of Minnesota in 1992 for postdoctoral training in pediatric neuropsychology and then joined the faculty. From 2004 to 2014, Cathy served as director of the Children, Youth, and Family Consortium in the University of Minnesota Extension, and she is recognized as a national and international expert in community-based participatory research and community-engaged scholarship. Her honors in this area include receipt of the University of Minnesota Outstanding Community Service Award in 2012, and in 2014, she was elected as an inaugural member of the National Academy of Community Engagement Scholarship. In the last couple of years, Cathy has focused on a new area of scholarship related to the developmental impact of children's interactions with nature. Last year, she received a 3-year grant from the National Science Foundation to support this work on the science of nature-based learning through a collaborative research network. She's going to share some of this work with us, including implications for healthcare professionals. Thank you for presenting today, Cathy.
Well, good afternoon, everyone. Thank you for having me. I want to set the stage a little bit by talking about some important trends that we're seeing in our society. Use of media by children and youth has become essentially a full-time job, 40 to 60 hours a week, according to the Kaiser Family Foundation. We also know that kids are being much less active. This is just one statistic about walking or riding a bike to school. And we also know that, of course, obesity has been on the rise for several decades and that it's epidemic proportions, at least in some parts of our community. We also know that we are seeing the incidence of chronic diseases that typically occur in adults. We're now seeing them in children, whether that be related to cholesterol or hypertension or diabetes. We're now seeing those diagnosed in children, and that is sort of scary because we know that, of course, that is going to lead to a lifelong path of chronic illness. And also children who are obese when they are children grow up tending to be obese adults with the sort of carry forward of those risks for chronic disease as well. Other disorders and diseases are also becoming more common, including asthma. Approximately 6 million children in the United States have asthma, and that has been on the rise, particularly in urban areas. The U.S. Surgeon General has said that this may be the first generation of children that will not outlive their parents. And that's hard as a parent to hear because you always want your kids to do better than you, but that might not be true with our current generation of children. There are also mental health concerns that have been on the rise. 20% of children have or have had a diagnosed mental health disorder at some point in their life. And of course, we know that ADHD is being diagnosed at increasing rates, as is the use of stimulant medication. So all of these things have multiple determining factors, but the disconnection from nature has been proposed to be one of those factors. And I want to suggest that reconnecting kids to nature may be something that could ameliorate all of these issues that I just talked about. So with that context, what I want to do today is first talk about defining nature. What do we mean by that? What kind of a nature experience are we talking about? I'd like to then review briefly some areas, some domains of impact, but then really try to focus more on health-related impacts, focusing on some health impacts that I think would be particularly interesting to folks who are pediatricians or who are working in inpatient or outpatient healthcare settings. And then I'd like to talk about the role of healthcare and healthcare providers in this movement to reconnect children to nature. So first, the definition. What do we mean by nature contact? So this doesn't mean just sort of being outside. It means actually interacting in some way with nature. You're there to experience nature. You're not there with just nature as a backdrop. This can happen in all sorts of different settings. It could be the backyard, all the way to wilderness and everything in between. It could be institutional settings like hospitals or schools. It could be home-based. It could be programmatic. It could be non-programmatic. The use of adults to guide or structure that activity might be a feature, but free play in nature might also be a feature. Activities might include learning, recreation, relaxation, recovery, therapeutic uses, and even viewing nature has been shown to be very important, and we'll talk about some research findings related to that. So what I'm not talking about here, as I mentioned before, is simply being outside, and I'm also not talking about activities that are, for instance, on the sports field. Those sorts of activities are wonderful and they overlap with some of the health benefits that I will talk about, but they're not the same thing as sort of interacting with nature specifically. Okay, so what are some of the benefits? I'm going to talk about a couple of them that are not specifically health-related first, just to give you a sense of the breadth of impact that a genuine connection in childhood to nature has been shown, or we are beginning to be able to demonstrate. So educational and learning outcomes, more and more research is being done in this area. We're seeing enhanced learning in subject matter. For instance, when learning is done outdoors in schools, we see things like increases in knowledge related to math or science or geography, whatever that subject is that is being taught outdoors. We're seeing increases in skills like mathematics skills or literacy skills. We're also seeing increases in test performance, for instance, in state tests on reading and math. Increased engagement and excitement for learning and for being in school, as well as greater pride in accomplishments when kids are doing learning activities outdoor. And then decreased discipline and behavioral issues. And that's an interesting one because one of the barriers that teachers often cite in taking children outside to do learning in a nature-based setting is that they feel like they'll lose control over the kids' behavior, and quite the opposite tends to occur. Kids tend to be better behaved, under better control, better regulated when they're outdoors, and that generalizes to when they come back into the classroom. It actually decreases behavioral incidences back inside the school building. So I'm just going to share a couple of research findings related to this educational domain. There are many, many more. This happens to be a study that was done in Spain that looked at high school students and the number of subjects that they were passing before they began a garden-based learning approach and then after they spent 2 years in a garden-based learning approach. And you can see the light gray is the subjects that they were passing before beginning the garden-based learning. The black are the subjects after they participated in garden-based learning. So essentially, garden-based learning was increasing the academic success rate of these high school students significantly. Here's one of these studies that has to do with that idea of the view of nature. And this is sort of a marker of how potent this effect can be. 101 public high schools in Michigan were looked at with the eye towards what kind of view are kids seeing out their cafeteria or classroom windows. Some kids had views of barren or built environment and some had green views, as you can see in the pictures. And what they demonstrated in this very well-controlled study was that these students who had green views had better standardized test scores, better graduation rates, more plans to attend college, fewer criminal activities. And the kids who had barren or built environment views essentially had worse functioning on all of those measures. Another domain that we look at or that we lump a bunch of impacts under is something called developmental outcomes. And these are things like cognitive development, maybe creativity, for example, executive function, things like planning, being resourceful, thinking ahead, social experiences related to learning to collaborate or cooperate. Of course, those need to happen in situations where kids are together in a nature-based environment. As kids get older and they experience more maybe wilderness, adventure sorts of things, those are ripe for developing leadership skills, as well as the idea of developing a sense of identity, as well as aspiration for what kids want to do educationally and vocationally when they grow up. So here's just a study related to that idea of creativity, and this is in younger children. Basically, this was 64 public housing outdoor spaces, 27 outdoor spaces were low vegetation, 37 outdoor spaces were high vegetation. And what they demonstrated was not only that play was much more common in the high vegetation areas, but creative play was really more prevalent in those spaces. When kids have an opportunity to manipulate the natural environment and kind of get creative with what they want to do with what they call loose parts, things like sticks and stones and pine cones and things like that, the creativity of their play enhances. Another major area of study has been this idea of developing a conservation ethic. Basically, the idea is that we don't develop a sense of needing to preserve the earth if we don't care about it, and we don't develop that sense of caring if we don't have experience with nature, essentially falling in love with nature. The studies that have been done looking at adults who are good stewards, who are engaging in conservation behaviors, often show that they have really important, meaningful, high-quality experiences in nature as children that they can point to as formative. Okay, I'm going to dive now into the health benefits a little bit more. So I'm going to focus on 4 of them, ones that I thought would be particularly interesting to folks who work in pediatrics and in healthcare settings, both inpatient and outpatient. And this includes physical activity, mental health, ADHD, and the idea of sort of recovery or healing in healthcare settings. So let's talk about physical activity first. Lots of studies have demonstrated that kids are more active when they're outdoors than when they're indoors. That includes even playing in an indoor gym, for example. When you have sort of big spaces, it just invites things like high energy running and jumping and climbing and things like that. And kids are 2 to 3 times more active when they are in outdoor spaces. They're not as active as if they're playing, aggressively on a sports field, but as far as, just play settings, outdoors pulls for more physical, moderate to vigorous physical activity than indoor spaces do. We also know that kids sort of they grow out of their physical activity in a way. As they reach middle school and high school, their levels of physical activity decrease, and that's particularly true for girls. And of course, that is correlated with weight management issues, particularly in girls as they reach middle and high school. Green schoolyards, and I'll define that in just a second, have been demonstrated to help middle school and high school students maintain their level of physical activity, particularly for girls, and particularly if girls have access to more wooded areas. Boys tend to like the stuff that's more running on a field, and girls tend to prefer to be in the woods. So a green schoolyard is one that has at least integrated into it, if not solely, elements of the natural environment. There might be access to nearby wooded space. There might be plantings, natural species. There could be play equipment, but it might have sort of a natural element to it. There's often playgrounds that are hybrid, that have more traditional playground sorts of materials as well as more natural materials. There might be water treatments. There might be sort of sand and water pump, sorts of things. There's been some really wonderful design research called post-occupancy research, where they've looked at what happens to kids' play and activity levels after you green a schoolyard, essentially. And very interesting things happen with regard to physical activity and play behaviors and social cooperation and things like that. So our schools are really important venues for this sort of thing. And unfortunately, only about 11% of our schools in the United States have any sense of having sort of a green schoolyard. And that would include even just having some vegetable plots. Okay. In the mental health area, stress has been one of the main areas that has been looked at. Other things have been looked at as well, things like anxiety and mood disorders, but stress is one of the major ones. And There was a really important experimental study done looking again at this idea of views. This was done in an experimental, randomized, controlled intervention sort of way. Students were randomly assigned to classrooms that had either no window or a view out on a built environment or a view out onto a green environment, and it was demonstrated that these students who had the green view recovered from stress more easily and more quickly than those who didn't, and I'll show you a graph of that in just a second. The authors hypothesized, they were sort of pulling at other theorists and said, why would this be? And basically their thinking is that it's multi-determined. There's an increase in positive emotions, there's reduced stressful thoughts, you're distracted from stressful thoughts, positive physiological changes related to the stress response, cortisol, for example. Those are possibly the mechanisms. So here's one of the results of this study. You can see the green is the green view shows the sharp decrease in stress, and this is a break in the classroom activity. So kids are participating in the sort of usual classroom activity, then they get some time off. They're either in a room where they can be looking out onto greenery, not looking out onto greenery, or having no view at all. And you can see that those who have the green view recover from the stress of classroom activity much more significantly. Interestingly, there's differences in the groups to begin with. Those who have no windows tend to, at baseline, have higher stress levels. So even looking out onto a barren view is helpful, or at least having some natural light is helpful, but the barren view is not particularly helpful in recovering from stress. Attention is another really important part of the research. This is one of the more robust findings in the research. Children's improvement in attention functioning has been demonstrated after things like randomized experiments looking at a walk in a neighborhood versus an urban environment, or this isn't a randomized intervention, but in this first study, took advantage of a natural experiment where families were moving from a more urban environment into different sorts of settings. Those who moved to areas that had more greenery versus those who did not have more greenery demonstrated increased attentional function that could not be attributed to things like the quality of the housing or a variety of other things that they controlled for. So it was believed that the variable that was at play here was the amount of greenery in their neighborhood. There's been some really important work done in Chicago public housing by three people at the University of Illinois, Andrea Faber-Taylor, Ming Kuo, and Bill Sullivan, who've worked in collaboration. And they've been able to take advantage of a number of sort of natural experiment sorts of situations. In this case, in the public housing situation, families are randomly assigned to a unit within public housing. Some of those units have views out onto greenery and some of them don't. And so they were able to take advantage of that and demonstrate that when girls, this is interesting, when girls living in those apartments with green views were tested on things like concentration and impulse control and delayed gratification, sort of those executive function and attention sorts of things, they did much better on those measures than girls who had the more barren view. Now, interestingly, that wasn't so true for boys, and one of the ideas here was they thought maybe, although this was not measured, that boys tend to have a wider roaming range and they're less dependent on what the sort of immediate surroundings look like in their home environment. So attention restoration theory is one of the main theories about why nature impacts us, particularly around attention, but also around other sorts of mental health concerns. And the idea is that we really have two systems. This is oversimplifying. As a neuropsychologist, this is oversimplifying. But we have two systems of attention. One is more directed and effortful. One is more involuntary. And nature is believed to capture that involuntary attention. It doesn't require work to sort of, look at clouds or interact with greenery. Whereas when we're in the classroom or when we're at work, for example, we're really paying attention. We're having to really direct our attention. So this idea is that you get directed attention fatigue, that those systems, those neural inhibitory mechanisms can fatigue when they're taxed in the classroom or at work. And what happens when you get out into nature, this happens for adults and for children, is it's believed that that directed attention system gets to shut off for a little bit, the involuntary system takes over, and it allows respite or recovery of the directed attention system. In ADHD, some folks are thinking about this attention restoration theory as being similar or important for ADHD, which is why I talked about it first. Attention in normal kids and attention in ADHD kids may have some common elements related to the attention restoration theory as well as other sort of determining factors. In this particular study, again by these folks in Chicago, children diagnosed with ADHD took a nature walk or took a neighborhood walk or took a more downtown urban sort of walk in a randomized order over several weeks. And then they had attention measured before and after. And as you can see from this graph, those who took the nature walk compared to their other conditions demonstrated improved attention. And the effect was actually really significant. It was the same effect that you would get if you administered a dose of methylphenidate. Of course, we don't know how long does that last. Does it last the same as a sustained release methylphenidate dose? We don't know that. But at least in the acute phase, nature had the same amount of impact on attention functioning as does a stimulant medication. And then this realm of healing and recovery, this has been a really important area of design research, looking at what happens inside healthcare institutions, schools, corporate buildings, that sort of thing. Of course, healthcare for us is important in our roles, and we can probably identify with our patients, particularly children who come into, let's say, the hospital setting, and there's a loss of control. Decisions are being made for you, everything from, what you're wearing to what room you're in to who can see you when, and those sorts of things. It's an unfamiliar setting, and we do everything we can to make it pleasant and maybe even fun, but it's still unfamiliar, which can be stressful. It can be isolating, away from at least friends, if not from extended families. Hopefully parents are there. And of course, there's fear. You don't know what's going to happen to you. You're sick, maybe. People are poking you and prodding you, and all of that is very scary. And all of that produces a stress response. So a lot of attention has been paid to how do we design hospitals and other sorts of healthcare settings to manage the sort of emotional response of patients and the patient experience. I had a wonderful experience of just getting a little tour of the chapel. Thank you for being here and taking me on the tour, Tisha. When we can integrate nature into these sorts of settings, these interventions have been demonstrated to have several effects, which I will go over in just a minute. But the way that we have integrated those into healthcare settings are both outdoor and indoor environments. The outdoor tends to be through children's gardens or healing gardens or therapeutic gardens. They go by various names, or rehabilitative gardens. We have something like that here at Children's Hospital, and there's some really stellar examples of that at various places. Boston Children's is a good example for one instance. But also bringing nature indoors is important, whether it be in an outdoor setting or in an indoor setting. Real nature, if possible. We just had this conversation in the tour of the chapel that real nature can't be brought into the space because of concerns around kids with immune function, essentially, but even having fake greenery is better than having no greenery, or art especially, whether that be video or sculpture or painting or, as is the case in the chapel, mosaic. All of these things can help produce some of those same sort of restorative responses that we see when kids are actually outdoors. There's a researcher at University of Washington, Peter Kahn, who does really extensive research on technological nature, sort of exposing people to nature through technology, video and other sorts of things. And he's been able to demonstrate that that is better than no nature, although it's not as good as real nature. So it does play a role, particularly if you have situations where kids have to be indoors. If there's reasons why they can't be outside, it's really important to evoke natural images and sensory experiences in the indoor environment. So let's just take the example of a healing garden. What are believed to be the mechanisms there? Why are these things important? So the belief is that for kids who are otherwise, or people generally, this is across all the age span, if you're in the hospital, you tend to be fairly stationary. Being able to get out into a garden setting allows some exercise. It allows some choice or control of where you go, what you interact with, what you do in the garden. It can be a gathering spot for patients as well as their families, and it can also, of course, connect people to nature in ways that bring around that restorative function that we talked about earlier. All four of these mechanisms are believed to have a stress buffering or a restorative sort of mechanism, which would then lead to health outcomes related to things like decreased experience of pain, less need for medication, decreased anxiety, potentially fewer complications, improved immune function. Of course, all those things lead to increased patient satisfaction with their experience, decreased costs, things like that. So now I want to talk a little bit about the state of the research. What I have been talking about so far, I've just given you some example studies. But this is a wide-ranging area. Connecting kids to nature is extremely multidisciplinary. There are education researchers and design researchers and cognitive neuroscientists and stress neurobiologists and healthcare folks who are all involved in various aspects of this field. And there are portions or threads of the research that are more robust than others. Some of it is relatively new. And in like any field that we begin research on, there's a developmental trajectory. So we start with the more observational case study sorts of studies. We move into more correlational, move into more experimental, larger sorts of studies, well-controlled, things like that. And certainly that's the trajectory that we're on with children and nature research. So in most of the domains that I've talked about, there are not very many studies that use designs that would allow us to make causal interpretation, so experimental designs or quasi-experimental designs. We don't have very many longitudinal or prospective studies. There are some, but certainly not enough. We have very little information about a dose response, like how much nature or how long do you need to be exposed in order for there to be an effect. Now, we do know in certain situations that the 20-minute walk, did the trick or something like that, but we really don't have specifics that would allow us sort of practice guidelines, for example. And we have some early knowledge of things related to interaction effects or moderating variables and the mediating variables or the explanatory variables. And those I want to talk about just for a few minutes because there's actually some interesting findings, particularly with the moderators. So moderators are that they influence the strength of the relationship between nature and health. And these are the things that are like the when, where, how, under what circumstances, or not the how, but the when, where, for whom, and under what circumstances sorts of variables. So just for some examples, all sorts of studies have been demonstrating that there's a relationship between nature and a particular outcome that varies based on something else. So birth outcomes is something that is being increasingly looked at. When mothers live in neighborhoods where there's more greenery, they tend to have longer gestational periods and heavier birth weight babies. But that's more true for mothers of lower socioeconomic status and lower education. So that's the moderating variable. Around academic achievement, a similar sort of thing has been demonstrated. the Chicago researchers again, this time looking at Chicago public schools, those kids who were in schools that were had green views and opportunities to be outside in greenery had better standardized tests, better grades, et cetera. But that effect was more significant for the schools who had lower socioeconomic students. Similarly, on academic achievement, but with a different outcome variable, greater impact for those kids with the more behavioral issues. So the intervention around learning outdoors had more of an impact for the kids who had the worst behavior. And then the last one around emotional well-being. This was looking at children's response to nature in rural environments, and that relationship was stronger for kids who lived the most stressful lives. So stress was the moderating variable there. Nature can be a moderating variable itself, where it plays a role in the response or the relationship between, for example, socioeconomic status and health. It's been very well established. Nature can alter that relationship, and it can alter the relationship between other related variables, for example, stress. And so we'll look at that for a minute with regard to psychological well-being. So in this study, there were over 300 kids in a rural environment in elementary school. They were looking at low and high nature conditions in those rural environments, and they were able to demonstrate that the kids who had the most stress in their lives benefited the most from their nature exposure in terms of their stress response. So basically stress is buffered by quality nature experiences. Mediators was the other important thing that we wanted to talk about here. This is the idea of the sort of mechanistic explanations. These are the how and the why sorts of questions. I'll just give an example regarding the stress research. Of course, we could look at all sorts of different impacts and try to hypothesize what the mechanisms are here. Some of these we have some information about, evidence-based information, but we have a lot of hypotheses that we don't know very much about yet. So social support may be an important factor here. When kids are outdoors playing, or learning, they build more friendships and more close social contacts, and that social connectedness has been demonstrated in other research to be important for the outcome related to health, and so that might be an explanatory factor there. That idea of restoration, being able to take some of your systems offline and restore cognitive function may be also important because it could allow clearer thinking, sort of better decision making, for example, better ability to cope with stress if your mind is more clear after sort of the restorative experience. And then, of course, the physiological, cortisol. We have some information in adults regarding the stress response. We have just a couple of studies in children that show a much more sort of complicated situation there. So that's a very important area of next research. So before moving on to the topic of what can healthcare providers do, I just wanted to follow up on what Iris had talked about in terms of the National Science Foundation grant that I'm working on in collaboration with the Children in Nature Network, which is a national nonprofit that I serve as the consulting research director for, as well as a second collaborator, the North American Association of Environmental Education. And this is a 3-year grant that is supporting the coming together essentially of a network of 25 or so, mostly researchers. They are from very diverse disciplines, from education psychology to eco-psychology to cognitive neuroscience, stress neurobiology, a variety of others in between, but also non-academics, non-researchers, people who are teachers or people who do teacher preparation, environmental educators, museum or informal science or informal learning environments, science communication, philanthropy, et cetera. This group is coming together around 3 tasks. One is to develop an aggressive research agenda for the field specific to nature-based learning. So all of these things that I'm saying, we have a little bit of information about, but not enough. Things like dose response and moderators and mediators and things like that. We will be posing those questions and trying to encourage the designs, the methodological designs that will allow us to answer the causal questions, the dose response questions, the mediating and moderating effect questions as well. The second thing that we'll be doing is doing some exploratory research here in the Twin Cities, looking at 3 possible mediators of nature contact's influence on kids' academic performance once back in the classroom. We'll be looking at stress, behavior regulation, and attention function. We also hope that these researchers and non-researchers, as well as their sort of peripheral networks, will want to peel off some of those questions that we come up with in the research agenda phase and go off and get external funding. We'll provide some seed money to do that. But hopefully this will spawn, essentially, a wave of advanced, more sophisticated research in the field. And then the third thing that we'll do is essentially a lot of science communication and dissemination, both to academic audiences, but also in innovative and creative ways. We've been working already on things like infographics to communicate what do we know to lay audiences. We could do TED Talks. We could do, readers' theater scripts. We could do all sorts of things as ways to communicate to non-academic audiences. So that's something that we'll be doing as we go along, and then specifically to communicate our own research findings. I want to talk now, switch gears and talk about the role of healthcare folks. And if we think about, kids' contact with nature or their connection to nature as being sort of part of an ecological model where there are various, I don't mean ecological in the sense of outdoors, I mean social ecological model. There are various influences, and of course we've got the folks who are most proximal to kids, their parents, for example, their teachers, but also their pediatricians. That's a very important person in a child's life if they have a consistent pediatrician. The next rung out are more community level, somewhat more systems level things like the healthcare system or the educational system, for example. And then distal are the things that are much more societal, things having to do with cultural values and media and things like that. So as I talk about just 3 quick roles for healthcare, think about the idea that individual healthcare providers can play a role here. We can also work as a healthcare system as well. And I would suggest that as a healthcare provider, as an individual, there's an opportunity to work across these circles of influence. You don't need to stay in your own influence zone. You can work at the healthcare system level. You can work at the policy level as well. So, for example, I would suggest that healthcare providers play a very important role in helping policymakers understand why something like nature's impact on kids is important for health outcomes. Healthcare providers can also do things within their own practices, their own buildings, for example, that will influence kids' connection to nature. The healing gardens, for example, or the bringing nature indoors, nature images and art and things like that, naturescapes that are indoor environments that are meant to mimic the outdoor naturescape environment. And then the third thing is something that is essentially becoming a little movement across the country that's about prescribing nature, and it's called Nature RX or Nature Prescriptions. And this is the idea that literally a pediatrician would take out a prescription pad and write down how much time, where, under what circumstances, and why should kids or a family or an individual get out into nature. And this movement was started in D.C. With the D.C. Park RX program by Robert Czar. And I'm going to play you just a 4-minute quick audio and NPR piece interview by him. He is an amazing advocate for this, and he literally practices this. He'll even go on walks in the park with his patients in order to help them sort of get accustomed to that and not fear that and that sort of thing. And he has worked with a variety of partners that you can see up there to create a really fairly sophisticated system where he can be sitting, and actually everybody in his practice can be sitting in front of their computer terminal, and they'll be able to call up the closest park to that family's address and, help that family understand how they can get there. And he does have this whole sort of prescription pad thing that he writes on, sort of the, where, why, when, and how much, sort of prescription. So I'm going to let him speak to you for just 4 minutes. Hopefully this will work.
Pediatricians are on the front lines in the battle against childhood obesity. It's a challenge for them to get kids to eat healthy foods or spend more time outside playing. But NPR's Sam Sanders found one doctor in Washington, D.C., who has taken to prescribing the great outdoors.
Pediatrician Robert Czar says about 40% of his young patients are overweight or obese. One day last year, Czar wanted to find a way to get one of his young patients outside more to help with her weight.
She has to take a bus to the train, then a train to another bus, and then that bus to her school.
Dr. Czar wrote her a prescription for a modified bus route to school.
That one read, walk the remaining 4 blocks on the second bus on your route to school from home every day.
He told me about the 4 blocks, and I told him it was a 40-minute walk, and I was too lazy.
That's 13-year-old Kelsey Aguilar. She says at first she wasn't feeling the route change.
I was thinking, am I really doing this? I'm going to be late for school.
Were you late for school?
No, I was 10 minutes early.
Kelsey's kept up the walking, and Dr. Czar says she's moved from obese to just overweight, which is very good. This micro-targeting of physical activity, tweaking Kelsey's specific school route, is something Czar does a lot for his patients. And now Czar says he might prescribe even more outdoor activity for Kelsey through a prescription for a park.
For the last 3 years, I've been working on developing a way in which I and my colleagues can easily prescribe parks.
Lots of parks all over the District of Columbia.
So what I have done is gone about mapping out all of the parks in D.C.
How many is that?
So far now we have 380 parks.
All of them mapped and rated. Czar did it with help. Public health students at George Washington University, park rangers, other doctors.
And this is cool. I just love seeing people doing things in parks.
Yeah.
I mean, here she is, jump roping this lady next to me.
Czar, standing in one of the parks in that database, Meridian Hill Park, talked about the rating system, which takes a lot into account.
How to get there. Parking, is parking available if someone's going to drive? Bike racks. There's a section on pets. Park safety, so we ask about lighting. And
Czar writes his park prescriptions on a special prescription pad in English and Spanish with the words RX for outdoor activity on top and a schedule slot that asks, when and where will you play outside this week? Czar says the program's not just about the parks. It's about what the patients want too.
I like to listen and find out what it is my patients like to do and then gauge the parks I prescribe based on their interests, based on their schedule, based on the things they're willing to do.
There are other park prescription projects getting started across the country in New Mexico, California, Oregon. Author Richard Louv wrote a book called Last Child in the Woods that actually inspired Dr. Czar to start his park prescription project. Louv says programs like Czar's carry a lot of weight because when doctors talk, parents listen.
Pediatricians can play a huge role, and that's why Dr. Czar, among others, is so important because they're so trusted by parents.
So, doctors prescribing parks. Good idea all around, right? But not every park is safe, especially in the district. The neighborhood next to one of the parks Dr. Czar has spoken with Kelsey about, Kingman Island, had 30 incidences of violent crime over the last year. But Czar says parks will only get safer with use.
The more parks are used, the more people are there, the safer and the better they are. So we want people first and foremost to be safe, to be active, and to be part of the solution to fixing parks that aren't quite what they should be.
Ultimately, Czar says he wants his parks database to exist in an app on your smartphone. And one day he'd like to be able to track his patients' activity in parks to find out exactly how much good a little green space can do. Sam Sanders, NPR News.
All right. So this is essentially turning into a movement. This has been, this story and others like it around the country have been in all sorts of media outlets. It's coming up in numerous cities around the country. DC was the first one, but there are now at least 150 other smaller, typically sort of Park RX sorts of programs. So why consider recommending nature? Well, it's very low risk. It's usually very low cost. It can actually be no cost. It's typically readily accepted by patients. It's not invasive, that sort of thing. As we've seen, multiple benefits have been demonstrated by the research. The important things to remember here in terms of how to do this is about being specific, and that means understanding why you would want to do this. Is this for heart health? Is this for weight management? Is this for emotional well-being? Is this for, attentional issues? And that why will help determine when, how often do you need to do this? How long do you need to do it for? Sort of how much, if it's physical activity, for example, walking 5 minutes is probably not going to be helpful, but moderate to vigorous physical activity for a half an hour, probably much more helpful. Being specific about what the activity is and what the challenges might be and how much effort is going to need to be exerted. Who might be along on this, if it's an alone sort of thing or with friends or family. And then really helping families think about where, because that's one of the barriers. Folks don't really think about what can I do, where can I go? And, we don't have something like the DC Park RX app here in Minnesota, but we do have the #1 park system in the country. And I did leave some maps of the Minneapolis park system out on the table out there and you can see that we have a lot of green space, both in Minneapolis and St. Paul. We have a guideline at least, and we're pretty good about following that every person in the city ought to be within a 6-block or a 10-minute walk to a park, which could be even just a pocket park, but some green space. So helping patients understand that actually green space is very close by, typically, if they are in the Twin Cities. And of course, you're not going to know everything about every place that your patients live, but encouraging them to connect with things like Parks and Recreation or the state park system or that sort of thing so that they can find the green space. For young children, you don't need to go find the green space. That can be the backyard. That can be, the neighborhood green space. And it's just helping them understand how to connect in ways that are more intentional. So it's not about just being outside, but actually interacting with nature. So Howie Frumkin, a prominent researcher in public health at the University of Washington, is a major advisor on these efforts. And he has, in commenting about the state of the research, has basically said, we have enough knowledge now about the benefits of access to nature to warrant action, and the risks of prescribing contact with nature are minimal. So basically, there's never been a study to show that nature is bad for you. we lack some rigor in some areas of the research, but basically it's all moving in the positive direction, and we can be confident that we're doing something good when we're encouraging kids and families to be outdoors. So I want to leave you with an invitation. The National Children and Nature Network and the local alliance, the Minnesota Children and Nature Connection, are co-hosting the second International Conference of the Children and Nature Network here in St. Paul at the River Center on May 25th to 27th. And you are invited. And I hope that you will come. There's a really interesting lineup of information from what can cities do to, there's a whole health track that I've organized around what can individual practitioners do. There's action labs, there's field trips. It's a really fun and very, very well organized conference. So I encourage you to go to the childrenandnature.org website and look that up. So I am done. Questions, comments? What else do you want to know? What do you want to push back on?
Thanks, Cathy.
Yeah,
I'm pleased to see such a wealth of information back up the good advice that many of our mothers gave us, which is go play outside.
Go outside, yeah.
I actually have two questions. One is fairly specific. You quoted the Spanish study that showed that the garden-based learning increased the number of subjects that students passed. In analyzing research like that, is there any way to distinguish between the effect of environment, like the garden-based curriculum, whatever was offered, and the level of attention paid to the learners through a different delivery system? In other words, is it the fact that it was garden-based, or is it the fact that there were simply teachers paying attention that contributed to their academic success?
Right. So ideally, you would want some experimental study where you had something like garden-based learning with a certain amount of adult interaction and some other thing with a similar amount of adult interaction. That's exactly the kind of experimental study that we need more of. I can't think of anything off the top of my head that is at that level. There's other ways that they've, exercise controls, et cetera, but the experimental studies are very few. Yeah.
And then the second question I had is, you alluded to much of what we know already, which is that many children spend a lot of time engaged with media, with screens, with electronics, and a lot of that is their own choice. And I wonder whether there's any information that suggests there have been successful interventions to change the balance of what kids are interested in, so they actually elect to go outdoors and do some of this stuff rather than being pushed to do it by adults.
Yeah. So there's a quote in Richard Louv's book, Last Child in the Woods, where a young child, not a young child, I don't know, elementary, middle school age child is asked, why do you like being indoors? And he says that's because that's where the electrical outlets are for all of his gadgets, right? It's not necessarily true that kids prefer to be indoors, prefer to be, doing video games or other, sort of media. It has to do with the accessibility. It's everywhere, Most households have multiple forms of devices. It also has to do with parent behavior. This is something I didn't talk about, but there's a whole bunch of different sort of barriers to getting kids outdoors. Parenting practices is a primary one. One has to do with the overscheduled child phenomenon where, well-intentioned parents are putting their kids in many activities. Those activities might be wonderful, but sort of, capping it at a couple and allowing enough time to be outdoors in free play especially is really important. So parent behavior needs to change so that kids can, have the time essentially in their schedules to be outdoors. The other important barrier that has to do with parents is around fear. The roaming radius for kids a generation or two ago, how far they could sort of move around their environment was like a mile. It's measured in feet today. Yeah, literally, you can't go beyond the block, kind of thing. And that has to do with parenting fears, some of which might be well-placed, traffic, if you're in a busy urban street or something like that. Some of it is not so well placed. Things like fear of abduction, that is a huge one. It's because our media, really blows up the few instances where there's stranger abduction. The statistics show that that's actually less of a problem now than it ever was before. So some re-education of parents is really important. So I think it's not that kids prefer to be indoors. I think that they literally have not had the exposure in their home life to the outdoors because of some of the changes in our parenting practices and the availability and omnipresence, essentially, of the electronic media. Yeah, Joe.
So, Cathy, sorry, I had to step out, and maybe you mentioned it. Does this effect translate across cultures? And I'm just not thinking about, North America and Spain, but Asian cultures, African cultures. It would seem there's a whole lot of population in Asia, at least growing up, in very little green space.
Right. There is research from around the world. It's typically European countries, Australia, a lot going on in Scandinavian countries, some in Asia. I haven't seen anything in the African continent, for example, but those more global studies that we do have all are demonstrating essentially the same effect. Interestingly, there are differences. I was just reading a study yesterday about a study that looked at generationally, essentially, kids' use of informal nature-based environments like the vacant lot kind of thing from a generation or two ago to now in Sapporo, Japan, and where was the other place? I can't remember, a European country, but I can't remember where it was. And they demonstrated cultural differences there, but the role of nature and the role of those informal spaces were just as important. There were just societal differences in how kids were able to use those informal spaces. But both cities in those countries had experienced the same thing, which is that there was decreased access over, several generations, either overbuilding, no green space, or restrictions, permission, that sort of thing. So, yeah, Michael?
You've done a beautiful job of making wide-ranging interdisciplinary research accessible to all of us. Ironically, it's the U.S. Park Service that provides a wonderful tour of Alcatraz prison on Alcatraz Island. Mm-hmm. And I remember when I was there, and I should add, as a tourist, it was their practice in the 1920s and 30s to serve dinner with fine silverware and linen tablecloths, the idea being that it would keep these high-profile prisoners calm. Mm-hmm. And apparently it did somewhat. Mm-hmm. Is there any literature yet that looks at the influence of green space on kids in juvenile detention or even adults who are incarcerated that looks at these positive kinds of impacts?
That idea of special populations, I probably should have put up there as another area that's important for future research. We don't know a lot about that. One, this is not in direct answer to your question, but I did see a statistic about how incarcerated adults have more outdoor time than kids do. They're getting recess, kids are not getting recess. That's kind of scary. Not that we should decrease the amount of time that inmates get outside, but we should be increasing the amount of time that kids get outside. So, yes. Next question? Nope, you're passing the mic. Okay.
Thank you so much. That was just a fantastic overview. I agree. The interdisciplinary aspect of it is really powerful. I have a question about a term I've heard in some other circles, nature deficit, even disorder, I've heard attached to that. Could you comment on that?
Yeah, so that is a term that's coined by Rich Louv in the book Last Child in the Woods. He is very specific to say this is not meant to be a diagnosable disorder. This is not a DSM, sort of diagnosis. It was meant, though, to, in his journalistic way, I guess, to draw attention and maybe to shock a little bit. So, okay, everybody take a step back and remember that he's a journalist, he's not a healthcare person, and he was using it for effect. But basically, what he is saying is that the disconnection from nature that has become essentially somewhat epidemic in essentially the last 2 generations of children is leading to disordered function. And so he coined the term in order to demonstrate that the impact of being removed from nature really has some significant developmental and health, et cetera, outcomes that are on the order of disorders. Yeah.
Thank you for your beautiful presentation. I have a question related to whether the benefits that are reaped are related to mostly being outdoors versus the greenery per se. And the reason I'm asking is the child who lives in an area where snow covers the ground most of the year at a disadvantage compared to that child who lives in an area like California where it's sunny most of the year and it's green most of the year?
Yeah.
Thank you.
Well, we do have evidence that there are changes in mental health for different geographic regions. Seasonal affective disorder is more prominent in the Pacific Northwest, for example. So I wouldn't be surprised if there were some differences. But I would also want to give a hopeful response that being outside in snow can be a wonderful nature experience, and you can reap the same benefits of, creative play and the social interaction and, learning about the environment and that sort of thing. It's just in a sort of narrower view, so to speak, of your biome. And I think the challenge is helping parents and helping educators and helping healthcare providers, et cetera, understand how to make use of the nature that is around us. There are certainly more challenges in certain areas, just like there are more challenges in some urban communities compared to, suburban or rural areas. There are going to be challenges related to weather and whether there's, greenery enough of the year. Yeah, that's a good point. Yeah. Any other questions? Okay, well, I think we're at time. Thank you.